Hello, everyone. I'm excited to be here today. I actually have been doing all sorts of things this morning. Was just on a TikTok live with another doctor, Dr. Ben Galliard. Check him out. He's doing some amazing things. He's located in Colorado, but he does a lot virtually and as a functional medicine practitioner. Anyway, we're able to talk about all sorts of things dentistry on there today. We talked about the big three. The big three are metals, infection, and airway, or getting enough air to breathe. And he was actually really surprised about the airway piece and said, wow, there's connection between, airway and dentistry. I said, absolutely. Probably literally 80-90% of airway issues have to do with something in the mouth, either structurally or infection based or whatever it might be. And I commented to him that I see people every single day from all over. In fact, this week we saw people from all over the country, and people are coming because of this comprehensive viewpoint of saying which things affect what, what affects what here, and how can we eliminate or get to the root cause of underlying problems and really address things from the foundational level. And once we address things from the foundational level, then we can build on that. And it's just exciting to talk to practitioners like this. I'm going to be introducing some really exciting things coming up. As you know, those of you who follow me at all know that I've written a book that will be released next year. Sounds like it's forever away, but honestly, it's not that far away. And it's all about how you keep your cells well, because if you can keep one cell well, literally one cell, kind of what our bodies are built of, you can keep every cell well. So I'm going to be teaching you how to do this. I'm going to be creating all sorts of information and resources online. I'm going to also be having some live in-person courses and trainings and things that I'm just really excited about. So I can't wait. And really, I believe that your body has the ability to heal. And the world and Mother Nature gives us everything that you require to be able to keep it that way, to be able to keep it healthy. So it will be really exciting to help you do that, to provide you the tools to be able to do that. Because, bodies are incredible. Our cells are incredible. You are incredible. You have been given every single thing you need to be able to do to be able to stay well. You just need to be able to help it. So let's tackle some topics. Today, I do want to talk a little bit about this airway piece, because I see so many people that have problems with sleep. So what are the symptoms that we would look for? In an adult, it would show up as brain fog, memory issues, just don't feel like you have enough energy, fatigue, those kinds of things. It'll also show up as adrenal problems. People will say, I have adrenal fatigue or cortisol issues, but what are some of the symptoms of that? This is really fascinating. Some of the symptoms of adrenal fatigue are you can't see as well at nighttime. You have a struggle. And I find myself doing this. I have to flip on lights where my kids are like, I can see just fine. I'm like, flip the light on. Can't you see? Well, this is some adrenal fatigue going on. It's also less tolerance for noise, for busyness. You just can't deal or adapt nearly as well when you just drained your adrenaline, your cortisol, all the things that are naturally in our bodies to be able to adapt. You can't do it. So those are things that are going to show up. Being cold all the time, getting cold even though it doesn't make sense that you're cold. That's an adrenal issue. So these are all things to look for and say, okay, could this be something that I have going on? Could this be something that's going on with me? Why I'm not feeling well? What does that have to do with airway? What does that have to do with any of those things? So also the typical sleep symptoms. I can't fall asleep. I can't stay asleep. When I wake up, I didn't feel like I slept. Tossing and turning, grinding your teeth, muscle soreness or tightness or headaches when you wake up in the morning. These are all signs that you're not getting enough air. So what do you do? What do you do about this? This is the big question. What do you do if these are some of the issues that are showing up? So the big thing we start with is a cone beam CT scan, because we need to see, is this structural? Is this something that's happening structurally here? That's number one. The second thing we do is a sleep study. We want to really figure out what's happening, because on a very small percent of the time, your brain just doesn't tell you to breathe. That's a very small percentage, but we need to find out, are you one of those? The other reason is because the tube that you breathe through is blocked. There's some obstruction. There's something in the way of this tube. So the CT scan can show us what's in the way of the tube. Is it infection? Is it because the mouth's too small? Is it because the tongue is tied down and falling back into the throat? What is it? We need to figure out what it is so that we can then treat it. So these are all the things that we look at as we see that cone beam CT scan, is what is it that's actually getting in the way of you being able to get enough air? And just yesterday, actually, a gentleman, I was talking to him and I said, your tube's so small. Like there's so much blocking off this tube that you breathe through that if you were to use a CPAP, it would probably almost blow right back off your nose. And he said, I have used a CPAP, and that's exactly what happened. He said, well, imagine that you're forcing all this air down a teeny tiny tube. Well, if there's more air that can actually pass, it's going to come back out, right? And so a lot of people say, I can't wear a CPAP, but literally like air blows into my face and I can't figure it out. It's because it's the tube problem. You don't just need more air. That's not the issue. You need the tube to be bigger so the air can get where it's supposed to go. So lots of underlying pieces. Get on my YouTube, get on my website, check those things out because there's so much information to be had here that people don't know. Love to share it. Love to talk about this. Okay, let's get into some questions here. I followed your advice. It has improved my daughter's teeth and health. Thank you. I'm so happy. But unfortunately, the deep tooth decay might not be able to be reversed. Do you recommend I remove the 10 baby teeth? This is always so sad when it's a kiddo that we're talking about here. So if this is baby teeth and if there is very deep decay, usually I will recommend, especially if it's a tooth that needs to stay there and depending on the age of your child, if it's a tooth that needs to hold the space for a little while. So let's talk about when do teeth typically come in and out on a child. So all the teeth should be in the mouth pretty much by 2 years of age, 2.5 years of age. And then permanent teeth start to come in around age 6. So you're going to see permanent molars coming in. You're going to see front teeth starting to lose here. So if your child is 5 and they have a lot of deep decay on these front teeth, well, you're going to know, well, it's probably only a year. So yes, let's get them out now. And then the teeth will be in within a year's time. If your child is 3, then you know, we have 3 years that we're going to have to wait before these teeth come in. So we probably ought to do the baby root canals, other things for the moment if necessary to hold the teeth because it holds the space. Because if you hold the space, there's room for the permanent teeth to come in. If not, okay, so she's 8 years old. This is good news, at least for front teeth. But if it's back teeth, so when do these start to come in and out? Typically, these is like 8, 9 in this area, typically 10, 11 here, and 11, 12, 13 here. So if it's back baby molars, it's not going to be till about age 13. So it might be at 8, you want to do some baby root canals, do some things that are required to keep even baby crowns in order to keep the teeth. Is it the same thing as a permanent root, an adult tooth root canal? It's not going to be the same thing, primarily because that tooth's going to be coming out. There's an end in sight for the tooth. If you do choose to remove a tooth on a child, what you have to do is retain the space or hold the space open for the permanent tooth to come in eventually. And on an 8-year-old, actually, it's easier because there's typically 6-year-old molars already there that we can glue a retainer to or a space maintainer to hold the space. So really options are remove the teeth, do a space maintainer, or baby root canal and crown to hold the space for you. Hard situation on a little one for sure. The goal is to never get another cavity. That's the goal. Okay, do we recommend tonsil removal for snoring? My son is 27 and wakes up tired. What would be the initial step to solve this? Would you recommend laser treatment rather than tonsil removal? Oh, such a good question. So 2 things we need to address in this one. Number 1, what is the tonsil doing? Why could it be swollen? And number 2, what are options other than tonsils that could help with the snoring? First question is, why are tonsils swelling? It's a great question. Why are tonsils swelling? So you need to look and see, are the tonsils actually swollen? If the tonsils are swollen, usually it's a mouth breathing issue, breathing through the mouth. So hot, dry air is hitting those tonsils and swelling up. So what do? You figure out, why is the mouth breathing happen? Usually there's not enough room in the mouth and in the nose for air to come through. So we expand and make more room for the breathing. And then the tonsils aren't a problem. I don't like to remove tonsils. Tonsils are basically the defense system of the head and neck. When you lose them, you lose some of your defense to be able to keep yourself healthy. So I want to leave tonsils alone. If tonsils are truly swollen, let's laser them for sure. But more likely than not, the problem is there's just not enough space. There's not enough space for tonsils, plus tongue, plus roof of the mouth, plus uvula, plus all of this. So usually this is actually a spacing problem. If you're snoring, it's most likely a spacing issue. We need to get a cone beam CT scan. That's step number 1, and determine what's actually going on from a space standpoint back here. After you figure that out, then you say, okay, do we need to just make the mouth bigger? Do we just need to use an expander? And we use removable expanders that can expand and make things bigger. Is that all we need to do? Do we need to train the tongue to come forward and up? We use something called myofunctional therapy, which is basically tongue training to do this. So that's going to be first step. First step for me would never be tonsils, never be removing tonsils. It would be figuring out what is the root cause. Is this a space issue? Is it an allergy? Is it a mouth breathing? What may be causing those tonsils to swell, and get that fixed. Because so many times I've seen people who get tonsils out on either a child or an adult, both. They get the tonsils out and the problem doesn't go away, because the tonsils actually aren't the problem. The tonsils are the symptom of the problem. There's something going on. They're swelling up because of their mouth breathing, whatever it might be. They're not the problem. So the problem doesn't go away when the tonsils go away. You just now reduced your immune system function. What are your thoughts on sealants? So sealants, the idea of it is that there's pits and grooves in the chewing surface of a tooth. And that's actually the area that decays the most frequently and the fastest. So the area that gets cavities the most is the pits and grooves in the chewing surface of a tooth. So the idea is awesome, right? Let's seal it out so no plaque can stay there, so no cavity will start. Idea is great. And I love sealants when they work, but 2 cautions about sealants. Number 1 is sometimes there's already a cavity on the tooth. It's difficult to detect a chewing surface cavity unless it's gotten fairly big. We actually use a laser to detect these cavities. But you need to make sure there's not a cavity on that tooth. Otherwise, what you do is when you put a sealant over it, you seal the cavity in, and now there's no way to brush, there's no way to get minerals to it, and it's going to grow quicker. So that's the first issue, is make sure there's no cavity before you seal it. The second one is make sure the sealant's done properly. It's actually difficult to do a good sealant because it's way back there. The kids are usually salivating. There's like saliva flowing all over. It's really difficult to get it really done right. And so what you need to make sure of is that they're keeping it very, very dry when they do the sealant. And really, honestly, 2 people ought to be doing it, an assistant and another person that can help. It doesn't have to be a doctor, but it really is best if there can be 2 people doing that sealant, just so it's done right and it's properly done and it's dry. If it's dry, it's properly done, it won't leak. If it isn't, then it may leak. I had a dentist, and if it leaks, you get a new cavity. And that's what we're trying to avoid, right? Let me finish that thought. I had a dentist that had me do a sinus lift and did a bad job with the implants. I've had a lot of health and sinus problems ever since. I'm in Utah. I may need to come see you. I'm sorry to hear that. Yeah, sinus lift, if people don't know what that means, is if you've lost a tooth on the top, oftentimes the sinus, because there's a lot of pressure in sinuses, just naturally, there's air pressure there, they will drop after that tooth comes out on the top. They will drop down, which leaves very little bone here to put an implant in. So we have to lift the base of the sinus back up so that there's enough bone to actually place an implant. It is a struggle if the implants have been done poorly and you've had issues ever since. Yeah, I think we better see you and let's get a cone beam CT scan. I need multiple extractions, bone grafting, and implants. What I need to do sedation. They recommend IV sedation, but that scares me. Can it be done without sedation? Okay, so this is one that I'm actually pretty adamant on. I 100% recommend sedation, and let me tell you why. When you have multiple extractions, bone grafting, implants, obviously they're going to get you numb. You're going to be numb for the procedure, but that's not the only concern. There is noise, there is stretching, there is holding open a long time, there's water in the back of your mouth. There's so many other things that go on, and all of these things stress your system. You're listening to this, you're getting stressed out, and even you're not hurting, you're not feeling it, but your body knows it's traumatic. It knows it's traumatic. And when the body goes through trauma, first of all, it pushes you into fight or flight mode. And second, it uses up all of your hormones that deal with fight or flight, that all the adrenal and the cortisol, all the things. So you get to the end of the surgery that's been traumatic on your system, and your body is at the lowest level possible for healing. It's used up all of its resources just to get through the surgery. The second thing is that you often have to go to the bathroom, you have to get up, you have to swallow, we have to do all these things, and it slows the procedure down exponentially. It makes it actually a lot harder to get things done very quickly, especially if you have a lot to do. So I 100% will go for IV sedation, would recommend IV sedation. And the nice thing is this is the kind of sedation they use when you get like a colonoscopy. It's on, it's off. It's not like general anesthesia. It's completely different than that. And we have a nurse anesthetist there with you the entire time. So somebody is watching you, watching your vitals, watching everything, very highly trained, very safe, actually. I believe it's safer to get it done with IV sedation than to do it without, because nobody's watching you, your body, and your reaction during a procedure that you're not sedated. The dentist is looking at the dentistry. The assistant's helping with the dentistry. It's nice to have somebody there watching you, watching your body and what it's doing the whole time. When will you be selling the tube toothpaste? My boys won't use the powder. I'm working on it. I was literally just emailing about this morning. Fortunately, manufacturing takes forever. So we are in the process. We're trying to figure out how to get it to not dry out in the tube, because I don't want any of the things added that keep it from drying out that are all the additives we don't like, but still working on it. So it's coming, but it'll probably be a few months. I've been using your tooth powder for a couple of weeks and the difference is huge. Thanks so much. I'm so glad to hear that. Everybody loves the tooth powder. Give it a try if you haven't. And there's some things you can do, if boys want to use the tooth powder, put it in use a scoop for it. There's ways, or there's other options too. There's some other toothpastes that have hydroxyapatite in it that are good options as well that you can use as a paste if you have somebody that needs to do that. Just make sure you're looking for hydroxyapatite. What about ulcers in your throat? Well, it's a really interesting question. What kind of ulcers in your throat and how often do you get them? And does it seem to be a cause? All those kinds of things. Usually if there's ulcers anywhere, it's an autoimmune or an immune system reaction to something. So if you have ulcers in your throat, it makes me ask, well, what are you eating or breathing or swallowing that you may be reacting to? So that would be what I would tackle first. I would check out something called NAET, which is an allergy elimination technique, to see if you can figure out what it is that you're sensitive to and reacting to. Do we see a lot of patients with deviated septum and turbinate issues that are causing airway problems? Yes and no. So let's talk about airway issues. There's two portions of your airway. There's something called the nasal airway, which is your nose, and there's something called the oral airway, oropharynx area, oral airway, which is down through here. So if you have a deviated septum and you have turbinate issues, meaning there's just not a lot of room for air to get through the nose, for sure, you aren't going to be able to get enough air in and to that tube. You may actually have double the problem, because typically when I see somebody that has a very small nose, a deviated septum, turbinates that are too small, I also find somebody that doesn't have enough room in their mouth for everything to fit. Why? Because the floor of the nose, so this bone right here, is the same bone that's the roof of your mouth. Okay, same bone. Bottom of the nose, roof of the mouth, same bone. So if the roof of the mouth is too narrow, it creates a very narrow nose, which creates very narrow turbinates, which often will lead to a deviated septum, because there's no room for that septum to stand up straight. So it has to kind of bend to see how that looks or how that fits. So that's, if there's a narrow palate and a narrow nose, it's often the reason for the turbinate issues or the airway issues through the nose. So if you can't breathe through your nose, you probably don't have enough room in your mouth either, because you have too small of a mouth, the tongue falls back. So I have so many people who say, I just had sinus surgery and I'm no better. Or I've had 5 sinus surgeries and I'm no better. Why? Because they're only dealing with one piece of the problem. They're only dealing with this part right here. But what happens once it gets past here? It has to get down and to the lungs. Well, if there's not enough room in the mouth for the tongue, for the tissue, for the soft palate, it's going to fall back into that airway. And even if you can breathe through your nose, even if they open your sinuses up like a freight train could drive through. I see so many sinuses like this. I'm like, holy cow, who did the sinus surgery? I could drive through your nose. And they go, yeah, but I still can't breathe. Exactly. Because just because you can get it in here doesn't mean it can go further. We've got to deal with the piece down here. Now, do we have to also deal with this? For sure. But here's the cool part. We have an expander, a removable expander that you can wear that expands the roof of the mouth, which, remember, it's the same bone as the floor of the nose. We see more nasal volume, or you being able to breathe through your nose better when we expand the roof of the mouth. So often it does both. It takes care of the nose and the mouth, no surgery required. Very cool. Would you recommend I don't get started with a holistic dentist until they get me a cone beam CT scan? I just saw a wonderful holistic dentist, but they don't have a CT, but send a van to me. You're going to need that CT scan to be able to have them even diagnose. So yes, the van can come to you, get that CT scan done, and then they're going to read it and they're going to tell you what to do. Absolutely. That is essential. There really is very little. They can treat gum disease. They can treat tooth decay. Those 2 things you can do without a cone beam CT scan, but that's about it. Anything beyond that, you're going to need that CT scan. Tips for dental care while pregnant. All right. So I love to talk about pregnant mamas and how do we take care of our teeth. It's all about nutrients. And here's the cool part. If you can get more nutrients into you get more nutrients for baby, and babies are healthier as well. So you need to add minerals on the outside and you need to add minerals on the inside for tooth care. The things you're going to do on the outside, you're going to use the tooth powder And depending on if you have sensitive teeth or not, either sensitive or the remineralizing version is what I would recommend. So tooth powder on the outside and mouthwash. Why both? Because the mouthwash is going to get deeper into the crevices and it's going to address gum disease. Gum disease is actually a real problem for pregnant women. So I want to make sure that we're not just taking care of teeth, we're taking care of gums as well. If a pregnant woman has gum disease, that actually, this has been shown through research, it will actually lead to lower birth weight babies. So we don't want that. We want gum disease to be under control. So you're going to do tooth powder and mouthwash twice a day on the outside. On the inside, you're going to do vitamin D3 and K2. Why those two? They actually help you take minerals and put them into your bones and your teeth where they belong. Vitamin D3 and K2 and tooth and bone formula. The combination of those are going to get you minerals on the inside, tooth powder, mouthwash on the outside, minerals on the outside. Why do you need to do this? Because when you're expecting, the baby always takes everything baby needs. And think about it. You are growing a human. You are growing bones and teeth and ligaments and cartilage and hair and skin and fingernails and eyelashes. I mean, you're growing all these things. How in the world do you grow it? By using building blocks from you. That's the only way baby gets it, is from you. So if you don't have enough to maintain your own health and to grow a baby, the baby wins. The baby will take it. So you have to have more than enough. You have to have more than you would unpregnant, if that makes sense. So vitamin D3, K2, tooth and bone formula on the inside, tooth powder, mouthwash on the outside. I got a cone beam and my Airway looks awesome, even double the size they usually see, but I'm still grinding at night. Could this be due to a partially deviated septum or nasal airway problem? Absolutely. Because remember, we just talked about there's two places it has to get through here to get to here. So if this is fine, you need to look at this. What do? You still may need to open the base of the nose, open the roof of the mouth to make more room through the nose. Now, there's some things you can even do at home that are simpler than that. You can do nose cones, they're called. They're little plastic things that hold your nose open. You can also do what's called an Inspire nasal strip. This works as well. So some of those things are easy things to just try at home, but it may be that you're going to need some expansion to make that nose bigger. I am set for a root canal to be extracted July 19th. Should I ask for a cone beam CT before that? Absolutely. Let's see what's going on. Let's see how much room there is in the sinus, how much bone there is left. Just find out what's happening. I mean, obviously you're already getting it out, so that's awesome. What are you going to learn in addition to that? Probably a lot about what you're going to do to restore it. Is there enough bone to put an implant in? Where does the infection spread to? Just to make sure you're going to get enough. My son needs dental care. He gets so nervous to sit through any procedure. He was recommended oral sedation. He's almost 6 years old. Oral sedation scares me. Help. What to do if he has a toothache now? I actually prefer IV sedation for kids, and I'll tell you why. Oral sedation is very unpredictable. Anytime you put something through your gut, it depends a little bit on gut function, on how that gut absorbs. It also depends on what the child ate, what the child drank. There's so many different variables that influence how that oral sedation affects anybody. I mean, you know this. When you take, an ibuprofen or any other medication, it may affect you differently than it does the person sitting next to you. Why? Because all of our bodies are different, and when it goes through the gut, it all has to go through a whole bunch of processing mechanisms. When they do IV sedation, what they do is they titrate it, meaning they start with just a tiny little bit of medication, and we use a nurse anesthetist for this. So there's a person in the room just specifically there for the anesthesia. They do a tiny little bit, and they say, is that enough? With the oral sedation, once you've taken the pill or the liquid, you can't undo it. You can't reverse it. It's all or nothing. It's in, and it's in. We did IV sedation years ago. This was so long ago on my son. He was maybe 4 or 5, something like that. And he was terrible at the dentist. And he had a tooth that came in with a great big hole in it. And I knew I needed to fix it. So I gave him oral sedation. He screamed through the entire procedure. I mean, he was numb. He couldn't feel anything. He screamed through the entire procedure, put him in the car, went to go home. He fell asleep and he slept for the next 11 hours. But he was awake the entire dental procedure. That's what we find often with oral sedation. With IV sedation, we do just a tiny little bit. We see, is it enough? They go to sleep. As soon as we're done, we wake them up. We are able to work very, very quickly. So it's a very limited amount of time with oral sedation. The medication's already in. We can't reverse it. Even if the procedure's done, they're still sleeping. So I love IV. I would absolutely say let's just do IV sedation instead of oral. My 2-year-old has been starting to get cavities in the front 4 teeth. He never drank juice or ate candy regularly. He has a high quality diet, breastfed until this point, and lots of day and late night feedings. How to reverse. So those cavities are unfortunately milk cavities, and it's even breastfeeding. People will just, they read me. They're like, how can you say that breastfeeding can cause cavities? I'm like, because it has sugar in it. It's natural sugar that's wonderful and all those kinds of things. But it doesn't matter. It doesn't matter what kind of milk it is. It has sugar in it. That sugar, if left on the teeth, will cause decay. I'm sorry. I am 100% believer in breastfeeding, but you have to do it where the milk does not stay. So when you're doing a lot of late night feedings, what's happening is it's sitting on the teeth. It's retained on the teeth against those teeth. And if it sits there, the baby's not swallowing, you're not using a finger to wipe, it's going to cause cavities. And it always breaks my heart when I see mamas that have this happen because they're just trying, they're just doing their best. And I am the very last person on the planet who's going to mom guilt anybody. You're just doing your best, and I get it. Now you're going to know. Now you're going to know what needs to happen. So what does need to happen? So back up, how to prevent it to begin with is after that late night feeding or daytime or whenever it is, you got to wipe a finger underneath that lip. You got to get the milk off of there. And usually that will initiate a swallow in the baby. That'll get that passed. That's got to happen. That has to happen. The other thing you need to think about is after about a year old, babies do not need nighttime feedings. I'm just going to say it straight up. Developmentally, they don't really after about even 6 months old. Babies do not need nighttime feedings. Some will even say 3 months old. Babies don't need nighttime feedings. So if you're feeding at nighttime, it's a soother. It's not for nutrition. So look it up. Look up developmentally, when does a baby not need nighttime feedings anymore? We shouldn't be feeding at nighttime because the milk sits against the teeth. So again, I'm not mom guilting anybody. I'm just saying, okay, now we know. Now we know. Let's learn and let's do what we need to do to keep baby number 2, baby number 3, whatever it is, next baby from having these issues. What do you do now? If there's already decay here, first of all, you're going to start using the kids' tooth powder. So the tooth powder, the citrus version, it doesn't matter if it's citrus or mint. It's the exact same tooth powder. It's just a different flavor. But the key here is that oftentimes kiddos don't like the flavor of the mint. So citrus they like. You're going to use it as a paste, and you're going to rub it all of those teeth. Now, I don't know the depth of the cavities. If they're big enough, if they're deep enough, you're probably not going to be able to reverse those, but hopefully you can stop it in any other teeth. You're going to rub it. You're going to let them go to sleep. So that's what's going to be on their teeth instead of milk at night. You're going to put minerals on their teeth at night. The other thing you're going to probably have to do is get some of those fixed. If they're deep enough, you're probably going to have to get them fixed. At a 2-year-old, you got a lot of years left. Unfortunately, you got a lot of years left. Okay, let's back up. I'm going to take a couple from here, people that are on. Okay, so I'm just looking up. Okay, very good. Can root fractures not be detected by cone beam CT scan, or the dentist have to open to see it? Root fractures cannot always be detected on a cone beam CT scan. Sometimes they can. If you're looking specifically for it, oftentimes you can't. So root fractures, unfortunately, we have to do some investigating to find them at times. My child fainted and face planted into a waist-high paver-topped planter box. What should I watch for as she heals? Suggestions to take to the ENT or the dentist. Oh, I'm so sorry to hear this. I hate it when a child breaks their front teeth. This just breaks my heart. What are you going to watch for? You're going to watch for graying of teeth. So if these teeth start to turn gray, it means they are dying and they're going to need to be dealt with. If it's permanent teeth, oh, these are such harder questions. If it's permanent teeth, then usually if they die, we do root canal now, knowing they're going to be removed when it's time to do an implant, when they're done growing at age 20 or so. If it's a baby tooth, sometimes we leave them for the moment, knowing they're going to come out soon. It's kind of based on age. So I would recommend a dentist, not an ENT. A dentist will know what to do. I mostly had problems with molars. Is this indicative of underlying problems? Maybe gut. So yes, the molar is on. Well, it depends on the molar, but usually it's the small intestine, large intestine, lung meridians here. So I would start with the baking soda test. I would give that a try. I would see what is your gut function looking like, and then move from there on healing and restoring it. I would also just use the tooth powder and mouthwash and see if you can get more minerals into this. Okay. Update. Yay, I love to hear this. Last week, you recommended using only the mouthwash for the pain I was having when using the powder. It seems to be working. I've tried 2 times to reintroduce the powder with better results. I have now noticed that it's only 2 teeth on the top, 1 on each side that's painful at the gum line. as if the nerve is exposed. Thank you for your guidance. I'm so happy to hear this. So what you're going to do is you're going to use the mouthwash, and then you're going to make a paste with that powder, and you're going to put it right on those two that are sensitive. Just try it. See if you can handle it. If you can, it'll knock that sensitivity out. If not, try the mouthwash for a little while longer and then go back to the powder. Love it. Can you talk to the difference between nano and non-nano hydroxyapatite? Which is better, or are they both safe and effective? Okay, so this is all about size. There was a whole bunch of talk about this and people wondering, what is this even about? It's all about size. So nano simply means the size of the particle. The controversy has come. There was a study done in Europe about cosmetics, actually, cosmetic applications of hydroxyapatite, and how they found that it was actually showing up in the blood and the brain. So crossing the blood-brain barrier because these nanoparticles are so small. So there's two things I'm going to say about this. Number one, we need a small particle to be able to get into the tooth, but we don't need it to be nano. We need it to be micro. So both my tooth powder and mouthwash actually have micro hydroxyapatite. About 8 of the little particles can fit inside one dental tubule, one place where they need to go. So they need to be small enough to fit, to get in and actually plug the tube so they decrease sensitivity, so they remineralize the teeth. But we don't want them small enough that they're going to go places that we don't want, which is the brain, right? So we use a micro hydroxyapatite for that reason. There are different sizes and there are different studies showing that shapes and sizes matter. All those kinds of things matter. But we've chosen the micro for this purpose. Small enough that it gets in, not too small to go places it doesn't need to go. However, I've got another piece to tell you about this because hydroxyapatite, when you swallow it, so again, we're wanting to spit out, whatever, but you're going to swallow a little bit. When you swallow it, it dissolves in stomach acid completely. It breaks apart into its constituents, which are like calcium and phosphate and other minerals. That's all it is minerals at that point. So when you're using it through the mouth, you actually don't need to worry about it because it dissolves into just the minerals. It doesn't even stay as a hydroxyapatite piece once you've swallowed it. So honestly, it doesn't really matter as much from a tooth perspective, from a tooth care perspective, if you're worried about consuming it, but we still don't use the nano for that reason. We want it to be small enough, but not too small. So that's kind of the long and short of it. Do I think it's okay to use betaine HCl with each meal all the time, or is that not a good idea? So what this is talking about is if you do the baking soda test and it shows that you don't have enough stomach acid that you can break, to break apart nutrients, minerals, proteins, all those kinds of things to absorb, the betaine, or you actually add stomach acid to be able to do it better. Can you use it every single time? Absolutely, you can use it every single time because it's just stomach acid. It's just what you already had. But my contention is why? We should figure out why you don't have enough stomach acid. So the next question is, what is the order of the gut supplements for healing? That's a great question. The order is identify. Do you need HCl digest? Do you need the betaine? If so, then you start using it. But it's actually not a phase of the gut healing. It's a Band-Aid. It's enabling you to get the supplements in. It's enabling you to get food in while you're healing. So then the first phase is repopulate. That is, we've got to put good bugs back in here. And a lot of times these issues with absorption have to do with antibiotic usage, killed off all the good bugs, a whole bunch of different things like that. So we want to repopulate, and we've got a couple, gut health and gut rebuild, that go together, that are both probiotics that will work together and repopulate. You use that for a month or two. I really like you to use it until you don't have symptoms anymore, till the bloating's gone, till things are feeling a little bit better. Then you switch to Gut Well. And I love the Gut Well powder myself over the capsules. Some people don't. Some people prefer the capsules. Either way, they work. They're going to switch to Gut Well for 2 to 3 months. And what that does is it's going to regenerate the lining of the stomach. It takes that long for cells to turn over, for cells that aren't well to be replaced by cells that are well. So we need 2 to 3 months for those cells to really regenerate. So Gut Well has all sorts of amazing herbal products that are going to regenerate that lining in the stomach. So you're going to repopulate. First of all, you're going to Band-Aid if you need it. Then you're going to repopulate with bugs, gut health, gut rebuild. Then you're going to do Gut Well to rebuild the lining. At that point, you're going to redo the baking soda test and see, do you need the acid still? What are the symptoms feeling like? If you need to stay on Gut Well for a little longer, please do. My goal is that you get off the betaine at that point. You get off the stomach acid and you don't have to use it because your stomach is working like it should now. All right, I'm going to tackle one more and then we're off of here. Okay, let's see. How much mouthwash should we use? Can we just put the paste on our teeth at night like the babies as well? Absolutely. I recommend this to people all day long, every day. So if you're having sensitivity, if you want to remineralize your teeth, if you want to prevent tooth decay along gum lines, if you have gum recession, if you have a small cavity and you want to reverse it, all of these things, this is how you're going to do it. You're going to use the tooth powder and you're going to brush. And it doesn't really matter the tooth powder. They all have hydroxyapatite in them, so they're all going to work. You're going to brush your teeth like normal. You're going to spit it out. You're going to go to the mouthwash next. And if you use the sprayer, I spray about 4 sprays, or I just use the cap or just do a little swig of it. So it's not much, it's a teaspoon, 2 teaspoons of mouthwash, typical amount. You're going to swish it around for 60 seconds. And you want it to be not just, you're not just freshening your breath with this. I want you to imagine yourself pulling it between the teeth. You're kind of, pulling it between the teeth and around. Make sure you're getting it up all around the gum lines. You want it to get in all the nooks and crannies. Spit it out. And then you're going to use the tooth powder with a little bit of water. So you're going to get a little bit of it out, use one of your teaspoons from your kitchen, whatever it might be, and add a little bit of, put it in your palm of your hand, add a little bit of water and make a paste with this. Then I want you to put it anywhere you have sensitivity, anywhere you have recession, anywhere you're trying to remineralize a cavity. You're going to put it there and you're going to go to bed. So this is your nighttime routine. In the morning, you're going to do just the tooth powder and the mouthwash. At nighttime, you're going to add the tooth powder a second time as a paste. Rub it along, remineralize. See if you can get those minerals deep into the tooth and let it just sit there at nighttime. And I think you're going to find some amazing results. Okay, I love your questions. Thank you all for being on here every single week. It's been so fun. I've got another podcast this afternoon. It's been all I've been talking about all day long, but I love it. So thank you all. Have a fabulous weekend. Have a fabulous holiday next week. It's my favorite week of the year because of the 4th of July, because my birthday is also next week. So I love this. I love the first week of July. It's awesome. Have a fabulous holiday, everybody, and we'll see you again.